This is the Clearway 2 in IPPB mode. First of all, switch the machine on. The machine will ask you to confirm that you have the correct circuit. The IPPB circuit has an expiratory port, so check that your circuit matches and confirm. In IPPB mode, the settings are along this side here, and the pressure gauge is here, and the flow gauge is here. To change the settings, first of all, set the flow by using the plus and minus buttons. So we'll start around 40 litres. Then set the pressure, which will start around 20 centimetres of water. Again, you'd use the minus and plus button to alter the settings. The plateau is the hold time while the patient has their breath in. You can alter this again using the plus and minus buttons. We'll start that at around 1 second. And the trigger level is the sensitivity. 1 is more sensitive and 10 is the most sensitive. 10 will be quite hard to trigger, 1 is quite easy. Around 3 should be okay for your patient to start with. You will see that the machine is ready for the patient to take a breath in when this face icon comes up onto the screen with a little arrow pointing in the mouth. You then ask the patient to take a steady, slow breath in. When they trigger the machine, the pressure will start to move towards the maximum. If you're not achieving the maximum pressure, you might need to increase the flow in order to do so. You'll see the flow on this flow gauge here. Once your patient gets used to those initial settings, you might want to increase your pressure. You'll also need to increase the flow to go alongside that, and you might want to increase the plateau so that you get a longer breath. If the machine is triggering too easily, you can alter the trigger setting. Once you've finished your treatment, you can switch the machine off by pressing this button and then pressing the screen.